Welcome back. As we promised, we are going to dedicate the last part of our breakfast show to the latest developments of COVID-19 here in Egypt and the most important measures which were taken by the government to contain the virus and to prevent its repercussions. We are very much delighted to have with us by phone the Presidential Advisor for Health Affairs, Dr. Mohamed Awad to shed more light on this important issue. A very good morning to you, sir, and happy feast.
Thank you very much, and good morning for you and for everybody.
Thank you, sir. Sir, I'm going just to enter into the issue immediately, as we do have a lot of questions why there is even a fourth wave. The COVID-19 is prevailing, if I may say, worldwide, and despite the vaccination campaigns, still the whole world is suffering. Why?
This is it is a very virulent virus. Very aggressive virus, and for the different viruses there is a possibility of mutation for certain types of viruses, and I think this is one of the causes of the spread of the disease. And it is very infectious, very virulent, as I told you, so that every infected person can infect 4 to 5 persons, and even some of the infected patients or individuals are asymptomatic. That is the problem of this virus.
So we should not be scared, but in the same time we should not underestimate the virus. So
yes,
wearing the masks and abiding by the precautionary measures regarding social distancing, for example, and using all the time the sanitizers. This should be our way to prevent this virus from prevailing or from being that contagious, or the vaccination is the real solution of the issue?
No, both of them. The preventive measures are number one. It is absolutely the most important methods to prevent the spread of the disease. For the virus, for the vaccination, it can also add to the preventive measures, but it's not an absolute measure to prevent the spread of the disease, but it can also prevent the serious complications of the viral infection.
Yeah.
So that actually we need both of them. We need the preventive measures, which is the first barrier against the infection. It must be continued, and then we can add the vaccination.
Sir, would you please elaborate on the most important measures which are applied by the government nowadays to contain the virus or to prevent more repercussions to take place on the ground?
Yes, the preventive measures, which is already published by the government and it's already implemented. It is the most important, as I told you, measures to prevent the spread of the infection. The cumulative effect of the viral infection needs the social distance, number one, needs the use of the masks for everybody, this is number two, and number three, you must use the anti-infectious measures or antiseptic measures to prevent also the spread of the disease.
In addition
this
to
is the most important measures which is already required for prevention of the spread of the disease.
Yes, sir. In addition, of course, to the measures taken in all our airports to have these very strict procedures implemented for all those coming from abroad, and internally or locally, the measures which were announced by His Excellency Prime Minister Dr. Mustafa Madbouli to have all the shops or the restaurants shut by 9 p.m. For at least 2 weeks, something which is going to end by the 21st of May. How do you see these measures, and if the latest measures are going to be extended after that?
I think during this week there will be some another action which will be taken according to the governmental approaches, which already they discuss the situation and the spread of the disease and the actual situation on the land, and then according to different circumstances they will take the final decision.
Yeah.
Taking in your account that the government is always trying to keep a sort of balance between or equilibrium between the financial situation and the health of the people, which is the first priority.
Sure, sir. Sir, what about the capacity of the hospitals or the readiness of our hospital to absorb or to receive all the patients who are really in need for being hospitalized for receiving treatment?
Up to now, definitely we have a good number of beds available for the patients in different governorates and also in the university hospitals. And we have emergency hospitals which can accommodate another good number of patients, so that the number of the hospitals or the number of the beds which would be available to accommodate the required cases or the patient requiring intensive care or critical care or mechanical ventilation. Already up to now we have a good number of reserve to accommodate the number of the patient, and we hope to keep that for the next period.
Sir, I'd like to speak in more details about the vaccination campaigns, about the inoculation, about the vaccines we do have here. Would you please, sir, elaborate on the kinds of vaccines we do have and the way we should deal with the issue? Because till the moment, we should be that frank and that there are people who fear to take the vaccine and say that maybe the repercussions or the side effects of the vaccines are going to be similar to COVID-19 infection itself. Would you please, sir, I'd like to hear from you as a doctor about this issue.
The vaccines up to now are very safe. We are reaching now about 2 million or less for vaccinated persons from the available vaccines in Egypt. One of them is the Chinese vaccine, and the second one is the UK vaccine, which is AstraZeneca vaccine. And as I told you, we have a good number of vaccinated persons, and up to now we didn't record any serious side effects from the vaccine. The recorded side effects, which is very mild up to now, including some reaction in the site of injection, redness, some pain, some aches, some fever or influenza-like symptoms, and the symptoms recorded up to now are the expected side effects or expected reactions due to vaccine, and none of them was serious side effects. So that the vaccine is safe, and we are trying as much as we can to bring a good number of vaccines from different sources, because, as you know, we have some international deficiency or world deficiency on the production of the required numbers of vaccines, and the countries they produce the vaccine, they have a lot of amount which is used for their population, and the number of vaccines which is available for the other countries is up to now limited number. But we are trying to get a number of vaccines from different sources, and we published the number of vaccines which already received, and we are trying to vaccinate some categories including the medical professionals, including the old ages or the senior peoples, and patients with chronic underlying disease. And I think now the scheme of vaccination is successful up to now, and we hope in the next period we vaccinate more and more people to reach a good number of Egyptians vaccinated by COVID-19 vaccines.
Dr. Mohamed Awad Tajuddin, the Presidential Advisor for Health Affairs, thank you very much for your input, sir. Have a very good day and happy feast to you. And by this, we come to the end of this episode of our breakfast show. To meet again same time on Nile TV International, on behalf of my dear colleague Amal Mukhtar and myself, Nirmina Abdurrahman, many thanks for watching. Stay tuned on our channel, and for more details, please log on to www.nileinternational.net. Many thanks for watching.